Welcome back. We're talking about reconstructive surgery. And you can call in with your questions, 0808-054-2233. Again, that's 0808-054-2233. You can also tweet at CTV_Mary A while we talk about this miracle of microsurgery. Now, people are asking, they want to know, what if any of their reproductive parts have been chopped off?
Well, if they go through internet, they will have read that it's very possible, provided you transport the amputated part to the center within six hours. It will be done.
Wrapped in sterile gauze and put in a nylon and packed in ice.
Ice pack, yeah. And transport to any center that has a microsurgeon, not just any hospital.
But when you talk about any center that has a microsurgeon, how many are we talking about in Nigeria?
Well, I only know of two, myself and Dr. Mofikoya in Lutz.
Just two microsurgeons?
Those are the ones I know.
May I ask why it seems to be such a rare field here?
Well, it's just not in Nigeria. Worldwide, microsurgeons are not common. It's not only in Nigeria. Because
people need things to be reconstructed. For example, nothing is torn, nothing is cut, nothing is broken. But perhaps somebody comes with a disfigured ear. You know that's out there in the open. Nobody wants one ear disfigured and the other looking okay. Is that a job for a microsurgeon or someone else?
No, a general plastic surgeon will handle that.
And he can reshape the ear?
Yes, yes.
Okay,
so you don't need microsurgery for that.
So right now, as it stands, correct me if I'm wrong, the normal thing that would happen if somebody were to have an accident, maybe in the kitchen or in the factory or, on the road, and something is chopped off, the normal reaction would be to say, I've lost a limb. I've lost that part of my body. Because I don't think people would know that they can actually reattach with fine surgery parts of their body and get them to work again.
Well, they may not believe you, but the day you called me for this interview, I was doing a case that's similar to what you just asked. I think a printing machine disarticulated a whole hand from the wrist. And I was at the surgery.
The whole hand was off of the wrist?
Yes, entirely. I was at the surgery for almost 15 hours when you invited me for this program. And by God's grace, the hand is okay now. It took us 15 hours. So any part that is amputated and you want it fixed, it has to be done within 6 hours of injury.
Within 6 hours, that's very important.
It's very important.
Within 6 hours, or it starts to rot, right?
Yes, it will. Whatever you do after 6 hours may not give you adequate function and aesthetics.
So, can you tell us what the ice does for that body part? Well,
the work of the ice pack is to reduce the metabolic rate of the tissue, and by so doing, it will prolong what we call the ischemia time. That's the time that the tissue can survive because the metabolic rate is reduced, so you can have more time to fix it. That's what the ice does to the
At this point, I've got to ask about cost. Is this for rich people only?
Well, it's not for rich people.
Just a minute, doctor, before you answer that, but do keep that in mind. We have a call on the line. Hello, Emmanuel, are you there? Hello, Emmanuel. Well, when he gets through, we can talk. So you were talking about the cost.
Yes, anybody can, have need for microsurgery because injury does not distinguish between a poor and a rich person. So what I will advocate is that we should improve on our health insurance systems such that patient will not have to pay out of pocket. Because when you are saying 6 hours, and this person does not even have the means to do it within 6 hours, what do you expect? So once we improve our health insurance system, patient can go into any hospital and they will be treated without, paying out of pocket.
In other words, what you're trying to say is that because time is of the essence.
Of course.
And the person might not have the money at the material time.
They won't have because they're not planning for it.
We need our health insurance to kick in.
Yes.
But when it does kick in, it should be affordable, right?
Yes.
Okay, that's terrific. So I'm really happy that your hand is working working really fine and everything. You know, I read about tissue engineering. Does that come into play in this work?
Yeah, it does.
That's
because
engineering
it's part of,
tissue.
yeah, it's part of plastic surgery. If there's paucity of tissue to be transferred, you can, you know, produce one before the transfer.
In what instances would you have a lack of tissue? Would it not be enough?
So many, like the skin now. If a patient has bones to the skin and you don't have enough skin to replace it, you can culture it in a medium before you transfer it to the patient. It's part of tissue engineering.
Let's take this call. Hello? Hello? It doesn't seem to be coming through. It doesn't seem to be coming through. So, are you saying that burns are an indication also for microsurgery?
No, it's not an indication for microsurgery. However, if the bones is circumferential, microsurgery can be of help. But what I'm saying is that a patient can have bones and you may not have enough skin to cover the patient. So you can take part of the little one and culture before you transfer it to the patient.
Okay.
But it's not basically microsurgery. It's not.
Are microsurgeons and what do they call them? Those people who help you move down.
No, physiotherapists.
Physiotherapists. Are they the only two specialties you need in an operation of this sort? Can you tell us how many people are needed?
We need we need good nurses, because after the surgery, the nurses will take care of the patient. So they also go for special training in this field of microsurgery. We also need intensive care units. That's the anesthetist. Because I said the last case I did took 15 hours.
15 hours.
So such patient cannot be moved to the normal way. He has to go to ICU. So we need good anesthetist. Then post-op, we need the physiotherapist. We also need the psychologist, because irrespective of what you do, some patients may not come back to their full function. So you need psychologists to work on them.
Okay, okay. So the mind can prevent you from actually using the hand?
Of course. I mean, if the function is not restored, you need a psychologist to work on such patients.
Okay, so he didn't need a psychologist.
No.
Okay, let me ask you, Mr. Akindeji Oladiji. How soon could you return to work and function normally?
I was ready to return the next day, but I had to wait for a week.
You were ready to return, but the thing is, were you able to use the hand satisfactorily at that time?
Let me say to you that by the time I was discharged from the hospital, which was about 3 days after the surgery.
Just 3 days?
Yes, I was discharged on a Tuesday. The surgery was done on a Saturday. I was discharged on a Tuesday. Right about that, I must say that by the time I got back home, I was back using the computer. I do a lot of work on the computer. I was back using the computer. Yes, doctor said keep my hands up so that blood will not stay there and will flow. But I was back using the computer and I was already using my fingers to type, because I like to type with both hands. By the second week, I was back on the road. I travel a lot. My job needs me to travel a lot, so I'm all over the country. And when I'm going all over the country, of course, I'm carrying bags, I'm carrying computers, I'm carrying different things as I move. So, but I had to take into cognizance that my hand had just been worked on.
So you had to actually remind yourself to be careful.
Yes, because at the time I could move things with it. So I feel a little pain, then I said, okay, you have to take it easy. But then it was there for me to use, and like I said, by the second week, I was actually typing and doing things with it. And then, of course, I continued to do the exercise that I needed to do. And I felt some pains on the bottom part.
And that was your cue to slow down.
Yeah, that was my cue to slow down.
That is. Yes, I'm very happy for you. Congratulations on the use of your hand.
Thank you.
Thank you so much for the doctor and both of you for coming. It's been a pleasure having you.
Thank you.
We have to close the program now. Thank you for watching. Don't worry, your calls will come in next week. Enjoy the rest of your day.